Dr. Melanie Palm, board-certified dermatologist at Art of Skin in Solana Beach, is back here in studio to talk about the 411 on melanomas. She is here, and you know, we should always be protecting our skin from the sun. Sometimes we tend to forget, and sometimes I find, Dr. Melanie, that we forget that there are different forms of skin cancer.
Yeah, so I feel like the preacher of skin cancer, but next month, May, is Skin Cancer Awareness Month. And Monday is Melanoma Monday, May 6th. So we wanted to bring some photos. I was here a few weeks ago of my own patients, both benign spots as well as different forms of skin cancer. Not only melanoma, which is the one we get really concerned about, but also more common ones, basal cell carcinoma and squamous cell carcinoma.
Oh my goodness. Well, where should we start? Which one do you want to focus on first?
Well, maybe, why don't we talk about some of the melanomas? So I don't know if we have some of those photos, but I brought several cases. You know, I've been shocked in the last 3 months. I've actually had about 9 cases of melanoma in my own patient population. So this is actually one of our own. And I want to show patients that you don't have to worry about the scar. If you go to a great person, that's a spot on the back. That little line of a scar is going to go away over time. But what did I not like about this? It wasn't something that the patient even noticed. It was a little bit irregular. There was actually a little bit of pinkness underneath it that I didn't like. And then there was sort of an irregular edge, which is things that we look for. We talk about the A, B, C, D, E. So I don't know. We can kind of go through some of these different photos. I know we've got several of them. This is a very typical melanoma. So is that one? It kind of looks like the ugly duckling. It probably doesn't look like the rest of the moles on your skin. I don't like that it's sort of speckled. It's got an irregular shape. We talk about the A, B, C, D, and E's, so it's got asymmetry for A. The borders are regular. There's more than several colors, which is the C. The diameter of this was starting to get bigger than a pencil eraser, and it was evolving. That's the E. So something new or changing for patients is something I really want them to look for. I tell them, you guys have a sixth sense about changing spots. If one gets sensitive, if one gets itchy, if it gets painful, I want to know about it. This is a benign sort of spot that I often get asked about. Patients say, I've got a new spot, it's growing, it's pink, it's scaly. This is something called a seborrheic keratosis, and it's a completely benign, waxy spot, but I think sometimes they can appear black, so they are really scary. Occasionally I even get referrals from other doctors for a spot, and it ends up being a seborrheic keratosis.
That is interesting. You said sometimes they are black, but in this case,
it's skin colored.
It's skin color.
It can be tan to sort of very dark.
Now, for these, at least these that you have shown us so far, would you have them removed? How dangerous are they?
So that's a great question. The first two, which were melanomas, we obviously want to get a biopsy. We want to understand how deep the melanoma is, because that actually predicates how we're going to treat it. Is it going to be something that I actually treat in my dermatology office if it's a thin melanoma, or am I going to work in concert with a hematologist, oncologist, and a surgeon if it's a larger lesion? You know, I use something called a dermatoscope. It's sort of like a polarized microscope that we look at lesions, and that gives me a lot of information about the pattern of something. I think it's a great thing to see your dermatologist using that. We use our eyes visually to take a look at things, but this is kind of close-up scoop on how it's performing. If it looks suspect, we biopsy it.
So it really is a case-by-case basis, which is so important to have these things checked out. And I'm so glad you brought in those pictures, because we're, you know, oftentimes when we talk about skin cancer, we're always talking about the, you know, the most, I guess, deadliest form, and you know, we always look for those spots that are the really dark ones and the ones that have the edgier surface. But a couple of those are not, you know, they don't have a lot of edges or bumps, and you may think that it's nothing, but it's worth checking out.
Absolutely. Or they're in areas you can't see. So I would say almost half of my cases were on the back or backs of the legs that I've seen more recently. And it was 8 out of the 9 cases of melanoma I've had in the past several months, the patients didn't even recognize the spot. So although people are really good at their loved ones or them finding a spot that isn't right, it's also great. Go and see a board-certified dermatologist once a month, especially it's month of May. We're actually doing a free skin cancer screening in our office, May 22nd from 1 to 5 p.m. You just call us. It's 858-792-7546, and you will get me looking over your skin.
Oh my gosh, that is a great thing that you're doing. That's fantastic. We'll put a link on our website and more information, as well as a video recap of this segment, KUSI.com.